You know, a lot of guys, they retire, they want to just like kick the feet up, you know, have their beers, watch football, play with their kids. I found out that the more time you take off, the more prone you are to like the old injuries creeping up on you, new injuries coming about.
Right.
You know, that's why I'm in here ultimately. Stupid ankle after, you know, so we did the knee. We can talk a little bit about my knee and the history of it. I religiously worked out this knee pre and post surgery with you. I've been with you for the last 10 years. The PCL, MCL, shaved the kneecap. We fixed it all pretty much, right?
Yep.
It was a tough time in my life. You obviously know that.
Spent every day with you.
A tougher time getting better, but let's talk about like immediate rehab that you had me do, which is important because had I not really listened to you, I don't think I would be as good as I am today.
Right, so you had MCL repair, PCL repair, meniscus, and like you said, some of your kneecap
shaved behind the kneecap, right? Smooth it out.
Yeah, exactly, because he had some roughening on the backside of his kneecap from I would say a career-long, a slightly wobbly knee with missing your PCL. For how many years in the league were you missing your PCL? 12?
Yeah, 12, 13.
12, 13 years, no PCL. Everybody thinks, oh, okay, that's fine. You can play without it, which you for sure can. But you just get this micro trauma on a regular basis of the knee moving too much. You start potentially getting an issue with your kneecap. You had that. And then how many MCL sprains? Right? In hockey, it's 5 at least, right?
At least 5.
So then you end up with a permanently stretched MCL complex, makes it more wobbly. And I think ultimately that wobble is what your initial pain before all of that really became a surgical case was you had kneecap pain. Yeah. And you talk about the Achilles tendon, in my opinion, of the lower limb is the kneecap. It's not the Achilles. Yes, if you blow up your Achilles, you're done. But the kneecap will take you out faster than anything. And you remember those days when you were up trying out for Edmonton, right? And it was like, buddy, all of a sudden I was skating fine, and all of a sudden out of nowhere, I couldn't put an ounce of pressure on it, right?
Yeah, crazy.
So those things combined, you get out of surgery. Day one, number one, the first phase was not to stay there for 2 weeks and do the rehab.
You're like, get back here.
Get out of bail, we'll be in charge of the rehab. They're in charge of the surgery.
For sure, and that's one thing that he would tell you, like, yeah, listen, I did my part. If you know how to do the next part and you trust the process, that's you. Right.
So then you flew back within 1 or 2 days, and then
remember I jumped in that freezing Vinny's pool.
So then the next phase of this early onset is to make sure you know how to do a proper waterproof tape job on an incision that is not a little one. So this thing is all butterflied open or butterflied closed with a lot of staples and stitches, and then I want him to jump in a dirty pool. And so he's telling me all these stories about
Tom Brady at the time was in the ocean, and he had
and he got an infection, and the surgeons are absolutely against getting in the pool, which I respect. But at the same time, if you know how to do this proper waterproof tape job, you put them at no risk. And then the goal is for 2-3 hours a day for you to move your knee yourself to get the fluid moving, not to stretch your MCL or to stretch your PCL that you just had surgery on 3 days before, but just to keep this thing globally moving, which is hard to do if you're not in a pool. And then we couple that with treatment, which has the same exact goal, which is to the micro movement. That's it. That's all we did for the first couple of weeks. But when you move the fluid and you move the knee, especially in rotation, all of a sudden, magically at 3 weeks, you could bend his knee 140 degrees.
Yeah.
That wasn't even something we had to battle. And because of that process, and because we're not fighting against range of motion already at 3 weeks, then you can take off running with exercise and putting the stim on and doing skaters and all those things at like 4 or 5 weeks like you were doing. You have good video of that and pictures?
Yeah, I videotaped the whole thing.
That's right, you were videoing all that.
What a lot of people deal with after this, they'll ask, like, how's the scar tissue? Like, because theirs is, they probably can't move their scar like that.
Right.
So I didn't have any scar tissue because I didn't let the scar like build up underneath. We moved it. We weren't letting it just
go dormant. That's right. Another part of that treatment was literally, obviously, even while the stitches are still on, there's still that gentle treatment to help realign the collagen fibers and make sure that the scarring is of little importance, because the scar tissue will have a direct effect on the joint underneath and other things.
So the knee itself, that was one issue. Have you done the same sort of protocol with guys who shoulders? You know, like, so if a guy has a shoulder rehab and is told to stay in his sling for 6 weeks,
right?
I mean, that's getting out of that sling in 6 weeks.
I mean, one of your former teammates was one of the first ones that we did with that. Where same thing, put him in the pool at day 2. At 6 weeks, he's ready to start, quote unquote, by the book, raising his arm. And that's when he was in Sweden, and he was on a phone call with the surgeon, and the surgeon said, okay, you can start moving your arm. How does it feel? And he went like this. And the guy's eyes got like this big.
Yeah.
So, but not because we did anything magical, but just because we did a responsible amount of micro movement of the fluid in the tissue from day 1 and didn't wait 6 weeks.
Yeah, the pool's a magical, for me, it was everything.
Yep.
It
wasn't easy to get you in that cold, dirty pool.
Yeah, but it's an easy thing unless you live in Canada in the middle of the winter. The pool, you should be, accessible to jumping in water. And I had the full suit on.
Yep.
We'll show a video. Full suit, paddles. I mean, and I had my hour and 30 minutes a day.
And you did
my
it.
legs, my hips.
Yep.
I came back to play hockey at a pretty crazy level at the time. So that's.
Yeah. That was impressive. A lot of hard work you put in.
And then, so my hands, those are issues. Every time I come see you, we work on my hands, because those would be, and you only got one pair, right? When these go.
Right.
And I know there's arthritis in these. I know that I want to keep my golf game going.
Right.
I want to, play with my kids, play volleyball, throw a ball. So, you've always moved like my thumbs. That's part of our, when I come see you, you're always, right?
Right. I'm trying to create more space in places where you've lost it from holding the stick since you were 4 or 5 years old.
Yeah,
you know what I mean? And that, plus your tightrope in your right hand, that doesn't help things. But yeah, just keeping, again, micro movement and of the fluid in the tissue, that's how, and maintaining the space, that's how you keep a young enough hand to be able to continue to do all those things. That's why that's always on the checklist.
What do you notice a lot with feet with your athletes?
Hockey players or athletes?
Well, hockey players in specific, maybe.
I mean, hockey players, you guys are a very special breed, much like skiers. You have your foot casted in a boot since you're young. So that's a whole nother level of, you want to be able to create as much mobility in the foot and ankle, because you're always in a boot for 6, 7, 8, 9 months a year, to, again, mainly spare the knee. Because if you start locking up the ability to move your ankle, you start exposing your knee. Same thing as the pelvis exposes it, or the foot and ankle. So
it could be a lot of back issues because your feet are locked.
Yeah, definitely.
A lot of hip, back. I mean, look at how many guys have hip impingements or lower back issues, back surgeries.
Lots of them.
Yeah, tons.
Well, and again, I go back to the pelvis for all that. I know that, every time I check your pelvis, because if the pelvis isn't right, then I know structurally L5 and L4 can't be right, and I know you can't move your hip well. Like, that's paramount, because that's part of what kicks off your lower leg, is the hip, the knee, and the foot and the ankle. So as far as the ankle goes, I mean, a lot of times they're too stiff, but other ones like you have a history of chronic ankle sprain. So then you kind of have to change your.
Pulling on them.
That's right. You gotta change your approach a little bit with that particular joint on your body, which is try to reinforce all those muscles of your ankle on a regular basis to put a little more stiffness there. That's why it's a customized project.
The things I wish we knew back when you're dealing with your first ankle sprain, or you're dealing with your first knee injury. I mean, it's all so tied into
everything.
The evolution of moving.
The classic ankle sprain also leads to a disturbance in the whole chain to make you less resilient for a concussion. I mean, that's like one of the big things we see with lower body injuries, especially the ankle, in a hockey player. If you disturb that chain to the pelvis, then you can also tighten the bag that goes around your brain. Then you get hit, and it's like a little nudge, and you got a headache. Versus other people, you've seen it all. You've seen it your whole career. They can take. You're like, how did that guy get back up? again, that's not the only factor. Some of those guys have a skull that's this thick. You know what I mean? Some of those guys we know well.
Totally.
And other guys, you're like, did you see anything happen to him? Like, oh, the stick hit him in his head, and he's been out. You're like, whoa, that doesn't make sense. But anyway, it's because the whole thing's connected, and a thorough understanding of that is kind of how we go about piecing things together, including when you hurt your kidney, right? Like, yeah, that was a traumatic thing, but the kidney is also connected to the fascia iliaca, which is of the psoas, and then you start being able to do specific stretches like you did, and you help decrease the likelihood that taking another blow will cause a problem with your kidney again. That was a big hit.
Yeah. It still hurts.
Still hurts?
No, it hurts looking at it or thinking about it. It doesn't really hurt. The kidney doesn't hurt anymore.